it's Linda McKenna from Golden Rule Senior Placement Services coming to you today with Tuesday Talks. We have a special guest today. It's Vaziri, and she's an occupational therapist. And we're going to have a discussion so this way you can engage in our conversation, how it's applicable to your situation. Hi, Lauren. Thank you for coming today. Really appreciate it. And, occupational therapy comes a lot into play with myself personally, with my family, as well as a lot of my clients. So for the sense of today, and for a lot of people that are going to be viewing, what is occupational therapy and what does it play a role in seniors?
Yeah, sure. Well, first and foremost, thank you for having me. I love occupational therapy. I love to talk about occupational therapy, so I'm happy to talk about it whenever I can. Surprisingly, though, many people don't know what occupational therapy is. More people are familiar with speech-language pathology, physical therapy, and then I come in as the occupational therapist, and they say, I don't need help getting a job. I'm retired.
Right.
But what most people don't understand is occupation is actually an old-time term. So occupation is not necessarily your job or your profession, but more as a means to describe what occupies your time.
Oh.
So an occupation, is more to describe what occupies your day, what occupies your time. And so when you look at that kind of at the broad picture, we look at what's called activities of daily living. So that can include everything you want and need to do. So for a basic ADL, that's your ability to bathe yourself, your ability to dress yourself, your ability to toilet. Might even be something as simple as brushing your teeth. Something very, very small to something as complex as driving, managing your own medications, even preparing a meal. So occupational therapy, my job as an occupational therapist is to meet a patient or a client that can no longer perform those occupations. So there's a barrier. Maybe it was a trauma, maybe they had a stroke, a fall, or maybe it's something that's more progressive that has happened over time. There wasn't one particular instance. Maybe it's Alzheimer's, maybe it's something like an ALS or something more progressive. And so either way, there's a situation in which that person can no longer perform the things that they want and need to do. So my job is to go in and meet that individual, figure out what their abilities are, what can they do, and what maybe they can't do so well, and try to make it so that they're able to be as independent as possible in their living situation. And so that's my job. More people, like I said, are familiar with physical therapy, and the way I always describe it to patients, to clients, is a physical therapist is skilled in being able to help you get to a bathroom, right? Maybe transfer out of bed, walk to the bathroom. Do you have the strength and balance to be able to do that? The ability to take one step after another and do it safely. An OT's job then takes over once you're in the bathroom. Can you shave? Do you know the sequence of being able to brush your teeth? Can you get on and off a toilet? Can you reach your behind after you use a toilet? Can you get in the shower? Can you stand in there safely? Can you bathe head to toe? After you get out, can you dress yourself? So on and so forth. So we work as a team. Like I said, more people are familiar with those other rehab professionals, but we do work as a team. But what makes OT stand out is function.
So do you feel that there is more steps with occupational therapy and more finite steps in their day? As you mentioned, with physical therapy, it's more about ambulation and all. So occupational therapy is really finite, so there's more details to that process of therapy rather than just a broad sense.
Yeah, so I think I can describe it as such. So an occupational therapist, our job is to do an activity analysis. And so what I mean by that, and that maybe is a term that someone may have not heard of before. An activity analysis takes a look at a general activity. It could be something simple, it could be complex, and break it down into those component steps. So if we look at something as simple as, I had previously mentioned brushing your teeth, it seems like, oh, well, that's real easy. Anyone can brush their teeth. But for someone who's had a stroke or someone that has a cognitive impairment or some other barrier, it's not that simple. And our job is to figure out, well, where is that disconnect? Where along those steps does that person's ability break down? So, to brush your teeth is actually quite complex. You need to know the sequence of turning on the water. Do you know what's hot? Do you know what's cold? Can you hold the toothbrush? Do you have the dexterity to do so? Or do you have a tremor and you can't hold on to it? Do you know that toothpaste goes on a toothbrush, or are you putting sunscreen on there? Brushing your teeth, are you doing it fully and adequately, or are you just doing a very surface level job and not really having great hygiene? Do you have the shoulder range of motion to bring?
So true.
And so that's the OT's job, is to look at an activity of daily living, whether it's simple or complex, break it down into its component steps, and figure out where someone's having that difficulty and try to intervene and make them as independent as possible.
I know, Lauren, you work in an acute setting, that you're, hospital, so you're at a bedside doing this. How do you feel when a person is at home and there has been a decline? May it be because of dementia or maybe they're post-stroke, status post-stroke, that their ADLs are definitely compromised. Not many, I don't want to say physicians or providers think of occupational therapy. They broad sense say therapy, and then it's always physical therapy. So from the acute side, I know you're recognizing it because that is something that is needed in the hospital setting, and sometimes really in the skilled setting also, because they're preparing them for going home. But if these folks are at home already and families seeing a decline, the provider, the medical advisor seeing a decline, physical therapy may be ordered by home health with their health insurance covering it. Do you see that being ordered more regularly, or is it just really grouped for physical therapy and not really pinpointed for occupational therapy?
Well, truth be told, because of COVID and a lot of regulatory change that occurred during that time period, we did start to see some more OT services in the home, which has been a big change, historically speaking, and having access to get to the patient at home, the client at home, because Linda's right, historically speaking, when people think of therapy, they think of physical therapy. So I think occupational therapy is very beneficial in the home, and I think if you have a senior loved one who you're noticing maybe some decline in those functions that I described, again, something as simple as bathing, which actually is not simple at all if you really think about it, to something as complicated as mom, dad, aunt, uncle can't manage their meds anymore, I would really encourage you to ask the primary care physician to order occupational therapy as well, because we are, not to brag, but we are especially trained in being able to assess a client and break down those individual activity components to really figure out, are they able to perform the task safely? Should they be doing it alone? Are there different compensatory strategies that we can employ to make them more independent, and so forth? So I would encourage, if you do see any decline in function, to definitely ask for an OT referral as well.